fell in love with DBP as an intern. I had a lot of inpatient rotations and not a lot of continuity of care. And I stumbled into this developmental peds rotation and suddenly was given this incredible amount of time to really get to talk to patients, understand their concerns, their fears, their thoughts, the misconceptions about the delays or things that they were struggling with. And I thought it was this kind of beautiful field that combined things I loved: genetics, psychiatry, complex med management, advocacy, community integration. It was just like all wrapped up in one. And I thought it was the thing that would give me the best potential for helping children. The biggest challenge in developmental peds, in my perspective right now, is kind of knowing where to focus our energies. There's only 800 developmental pediatricians in the country, and 1 in 36 children have autism. About 1 in 9, the most recent stats I heard, have ADHD. And those two things alone, which are only a portion of the things that we kind of deal with or manage in developmental peds, can take up an incredible amount of time, which means that a lot of developmental practices and centers have had to focus their energies on just early autism diagnosis to try to get through the wait list, which is very important. However, I like the complex med management. I love the continuity of care and following patients for a long time and really getting to know their families, and that's important to me. So the challenge is finding a way to address the need while practicing the kind of medicine that kind of fills my cup. I had not heard of the Elevate conference before, but I've networked with a number of psychiatrists in South Carolina who are presenting here this weekend. And as I was kind of venting some frustrations about how I wish I could do more, I wish I could see more, learn more, they said, you should consider this conference. Apply for this scholarship. They love to bring in new people and increase the reach. And I looked it up online. This actually sounds really interesting, and more so than many conferences I've been to, like really clinically focused. So I applied for the scholarship, and here I am. The experience has been kind of everything it was like talked up to be by my friends. The things that I was hoping to get were kind of complex management or kind of new perspectives on ADHD management, treatment-resistant depression, anxiety, things that I often see or would treat alongside an autism diagnosis or a developmental delay diagnosis. Lots of discussions about new therapeutics, and I've seen all of that on day one in some capacity, in addition to some lectures on starting private practice, which is not something we've been exposed to a lot in general medical training. So I would say so far on day one, it's a success. It's been really great to see an entirely different perspective on the same conditions I treat and how they're managed in different regions and different practices, given different barriers. And I've seen a lot of that here as well, just in the scholar program. The breadth of professionals is incredible. And so I guess I would encourage anybody who's even a little bit psych-adjacent, like developmental peds or adolescent medicine, to consider something like this, because the more perspectives you can see, the more opinions and approaches to managing these really multifaceted conditions, I think is going to be the best way to advocate for our patients. And so far, this is pretty incredible.